for pre-K kids anymore. We're going to go to a whole new approach to gifted and talented, and that will be unveiled in September. We're going to work with people and stakeholders all over the city to develop that approach. We're going to make more changes. We've made some already. We're going to make more related to screen schools and ensuring that there's maximum opportunity. Derek, is the specialized high schools. The status quo is absolutely broken. The plan we put forward didn't succeed. It's well known. But we need change with the specialized high schools. And I'm sure there's lots of good ideas out there to how to do it. But the one thing I know is they do not represent the people of this city, and they have to be changed. And that won't happen on my watch, but I sure as hell hope the next mayor can get that done in Albany.
We have time for two more. First, we'll go to Caroline from Gothamist.
Hi, thank you. Mr. Mayor, first of all, I am interested in a study that came out last week that found that it is safe to have students distancing 3 feet in schools rather than 6 feet. And I'm wondering if this is something the city is taking into consideration, and if this could allow all students to return to school 5 days a week.
Yeah, I'm going to start, and I'll turn to Dr. Varma and Dr. Choksi, because we have all been discussing this idea for quite a while, and this new study is important. There's no definitive answer yet from everything I've heard, but what it does tell us is it can really get stronger to get to that point. But obviously then that will beg the question of distancing as well. So we're examining this closely right now. Let me just get a quick comment from Dr. Varma, then Dr. Choksi.
Great. Thank you very much for the question. Yes. So first, as it regards to this specific study, it's absolutely additional useful information. I do think there are some important limitations because it was, comparing large areas which may or may not have had identical measures in place. But it does point to what we are increasingly learning, which is that school settings in which careful measures are applied, it can be conducted, can have safe in-person learning. And we also know that children, particularly young children, are less likely to be the source of outbreaks than older adults. So we are eagerly awaiting further analysis of this. We've been in regular communication, for example, with CDC, which is doing a number of studies, particularly in laboratory settings, to try to define this. And once the evidence becomes stronger, we do hope to look at ways that we can make in-person learning more available and more like the way it has been in the past.
Thank you. Dr. Choksi.
Yes, I agree with Dr. Varma's assessment of this study, and we'll just add that what has characterized our approach to opening schools in the COVID-19 era from the beginning has been a commitment to rigorous health and safety standards. And the mayor has charged us to continue doing that, and so we interpret any new evidence in that context. One additional factor that will make a difference in the coming weeks and months is vaccination, particularly because we know that it will curb spread further within adults who are in the school setting. So we'll take all of those factors into consideration, but always with the focus on the health and safety of students, which importantly also has to take into account the health benefits of in-person schooling. So those are the things that we'll be looking at to evaluate the evidence in the coming weeks.
Thank you. Go ahead, Caroline.
Thank you. Yeah, because I've heard a lot of, frustration. I think we've heard a lot of frustration from people about schools, opening and closing. And I think there's some hope maybe resulting from that study. But I have another question about the fact that so many more New Yorkers will become eligible for the vaccine this week. I heard, the figure is 80% of New Yorkers statewide will be eligible after this new phase. So I'm wondering, does the city have the vaccine supply and staff in place and other things it needs to meet that demand?
Yeah, let me first of all say, okay, before this most recent one, it was already over 5 million New York City residents who were eligible, 76% of our adult population. I have to get the latest count with this additional categories. But clearly we can say now, vast majority of New York City adults are now eligible. And I agree with President Biden entirely. May 1st, everyone becomes eligible. I think that's a great plan. Do we have the vaccine centers? Yes. Do we have the space and even more space available as needed? Yes. Do we have the staffing? Yes. And we're adding 2,000 more members of our Vaccine for All Corps. What are we missing is one thing and one thing only: supply. Right this minute, this week, we will be, give or take, 200,000 doses below the supply level that we could provide to the people of this city. If we had 200,000 more doses dropped on us this week, we could use them all. So, Caroline, we have the capacity. We've had the capacity now for many weeks. It's just about supply. And if that gets worked out, both with greater supply coming from the manufacturers and the federal government and getting our fair share from the state, we can just really, really move forward intensely because we're ready. Go ahead.
For our last question, we'll go to Alexa from News 12.
Mr. Mayor, how are you today?
I'm doing well, Alexa. How you been?
I'm good, thank you. So another question on vaccines for you. The 24-hour pilot program at the mass vaccination sites has stopped. Can you tell us if it was successful when it was running and if it just stopped because of supply?
Well, I'll turn to Dr. Choksi, but I'll say, look, we have a couple of different things we need to achieve simultaneously. We've got to get the vaccines out into all communities, particularly the communities hardest hit by COVID. We've got to fight disparity. We've got to have the most grassroots effort possible. So the more local centers you can have, particularly in trusted neighborhood institutions, the better off you are. But the bottom line is the supply problem. If we had supply, we would be running, I think, a number of places 24/7 because there was clearly a lot of demand. So I'd say it worked, but it only works if you have a huge amount of supply. To me, this goes back to the central problem. I also think the biggest sites, the ones that the state put together, with Javits Center and Aqueduct, the problem we found there was that those sites were not reaching enough New York City residents, and they were not helping us fight disparity. So this is, again, why where we have 24-hour sites that are in the right places, it really makes a difference. Dr. Choksi?
Thank you, Mr. Mayor. And first, I'll just start by clarifying that the city sites that are running 24/7, those will continue running on that 24/7 schedule. My understanding is that the Javits Center, which is run by the state, may be reducing its schedule to not be operating 24 hours a day. But what we have found is that, as the mayor was saying, it's so important for us to have reach of our vaccination campaign, both in terms of space, getting into the neighborhoods and the communities through the trusted institutions where people get their health care, but also in terms of time. We know that particularly for essential workers, having hours early in the morning, late in the day, and overnight, those are critically important as well to ensure that people are able to access vaccination in a way that is convenient for them.
Go ahead, Alexa.
We're saying the Javits Center is going to take away some of its overnights, but what about Yankee Stadium? Is it also going to have less appointments?
What about, say again, where?
Yankee Stadium, because that's like in the Bronx, which was a hard-hit community because of COVID.
Now, again, what the state is doing is its own thing, and again, you won't be surprised if I can't comment for the state of New York. They make their own decisions. I often don't agree. But the Bronx operation was put together by the city and state working with the extraordinary organization Somos that has been doing great work. And that's a place I think absolutely a 24-hour approach works in, exactly for what you said. The Bronx is a place hit so hard by COVID. We need to reach people nonstop. Lots of healthcare workers, lots of folks who work the night shift and one thing or another who would benefit from a 24/7 approach. So, Dr. Choksi, you want to speak to anything, latest information about Yankee Stadium?
Sir, I don't have any more updated information than that. We'll just say again, when we have the supply, we are committed to expanding days of the week, hours of the day, whatever it takes to get shots into arms as quickly as possible.
I want Dr. Choksi to repeat one important thing. What is the best vaccine, Dr. Choksi?
The best vaccine is the one that you can get now.
Mr. Mayor, can I say something about
Of
vaccine
course.
sites?
Commissioner Khaleesi.
So I just want to say on the vaccine sites, our office has been doing a tremendous amount of work to ensure accessibility is there. We've heard some feedback from the community about seating for people that may need it. We've been working on that, have implemented that in areas as well. I've had the fortunate ability to get the vaccine for my underlying conditions. So I'm happy and grateful that I'm able to do that. I encourage every person with a disability to get it because our lives depend on it. And the people at the vaccine sites and the accessibility is there. And like the mayor said, we have the ability to do it. I am confident in the people of New York City to be able to get this throughout and through everybody, for everybody, because we are the city of New York and we get things done.
Amen. Yeah, and you are a true New Yorker, sir. I can hear it. Everybody for everybody. Let me tell you, that really summarizes beautifully everything we're talking about today, but also the very moving moments we had last night at the memorial, because so many of the stories we heard were about people being there for each other, everybody for everybody. And that's how we'll come back. That's how we'll come back. There's a lot of places in this country, in this world, where people look to New York City, they have a lot of respect for New York City, they look up to New York City, but sometimes maybe they think New Yorkers are a little bit cold. But you know what? I always say, New Yorkers have hearts of gold. And New Yorkers are amongst the most compassionate people anywhere in the world, and people who really look out for each other. So that's how we come back. That's who we are. Thank you, everybody.